welcome back everybody to the Lady Leaders series. We were just joking. All three of us have had whatever crud has gone around, so forgive the super awesome voice I have and potentially all of us have. But I'm really excited because we've been trying to get Michelle Jorgensen on with us for a while. So I'm really excited to have her get to be a part of this because we're going to really go into a topic that so many people ask about, which is health-based dentistry and how to start to assimilate it into your office. So first off, thank you so much, Michelle, for being with us. We appreciate it.
Thank you.
I want to just jump in first into a little bit about your story because you have an interesting story, but then also how you got into health-based dentistry to kind of give us that journey.
And the story takes you to that answer as well. So yeah, I'm a general dentist and I come from a dental family. My father's a dentist. I have 3 younger brothers, 2 are orthodontists, and one's an oral surgeon. And that's just kind of what we do. And I thought I would practice just like my father. He's still practicing in his mid-70s. And I thought just that's how you did it. Like you just keep working and you don't have problems and you just keep going forever. And that's not how it worked for me. I started getting really sick at about 8-10 years in or so. And I didn't know what it was. So I started doing what we all do. I went to every doctor I could think of. I got all these tests and MRIs and nothing really was showing up. Everybody said, you're just fine, which is like the most frustrating thing, honestly. You just kind of want an answer. So didn't have any answers. My big symptoms were gut issues, lots of gut problems, but I also had, my memory was just fried. I just couldn't think of anything. It was like brain fog on steroids, and my numbness, my hands were so numb. I couldn't change a burr in a handpiece anymore. I had to just shake my hands out in between every about 5 minutes working, and it just wasn't going to work. So I had my practice for sale and I was going to try to figure out my next thing. And I actually talked to another practitioner and they said, have you ever looked into mercury poisoning? And I said, well, I don't have any amalgam fillings. I've actually never even had a filling. So I wouldn't have that problem. And he said, it's not the ones you have. It's all the ones you've been drilling out for the last decade and breathing in all the vapors and no protection. And of course, I had never heard a thing about that. Most of you on here probably never heard a thing about that. I didn't know it could be a problem for me or for, anybody in the profession. But I thought, well, I don't have anything else to lose. So I got tested and that's what it was. Mercury toxicity, just off the charts. And then I started learning about mercury. It's a neurotoxin. So numbness, brain issues, gut problems, they all go along with mercury problems. So it all made sense. And so I started, I thought, all right, well, can I keep doing this then? Can I keep being a dentist if this is, part of my profession? And found out that there was an organization that's dedicated to safe mercury removal. And I didn't know they existed either. So I followed their protocol and I started incorporating them into the practice. And they're pretty obvious. So when I started doing those things, patients were like, what are you doing? This is definitely not what you did last time. And so then I'd share my story and tell me this is for me. But obviously, if this could be damaging or dangerous for me, it's going to be, not great for you either. So I'm grateful that we can do this for you too. And so they started saying, well, my doctor actually is really interested in that. Can I tell them about you? And so doctors started calling, and then doctors started asking, do you do this? And do you do this? And do you do this? And I didn't know what they were talking about. Like all the things they were asking me, they were all brand new. Like dentists, we don't know it. Doctors, they did, but I didn't know any of it. So I'd have to go find some class somewhere and learn about the thing they were asking me about. And the more I learned, the more I realized we need to learn these things. There is so, we talk about the oral biome and periodontal health and the oral systemic connection, but honestly, that is like the tip of the iceberg, honestly, at how dentistry affects the overall body. And as I started to learn, I thought, oh man, boy, we need to know this. We need to know how we impact health and what we can do for good for people too. So I just started changing the practice. And as I did that, the practice started growing and growing and growing. And so now we have a multi-specialty practice with 7 doctors, and we see people from all over the world. And it's really just an amazing genesis that I did not expect. I did not go here intentionally, but now that I'm here, I wouldn't be anywhere else. But it was definitely because of my own health challenges that I got here. And now I've learned a lot along the way.
How quickly did your symptoms start to resolve after you changed how you did
Not
dentistry.
quickly. Not quickly, because mercury doesn't go away fast. So I really honestly don't think it was gone or really significantly gone for about 5 years. But I mean, I noticed changes soon enough that I could keep practicing, but mercury it holds on for a long time. And I really feel like mercury is something that we as dentists just need to be detoxing from nonstop, just constantly, because it's just in our environment. Even if we're doing this safely, it's in the HVAC system, it's everywhere hanging out. So yeah, but it was noticeable enough that I could keep going.
Okay. Okay. So tell me now, what is, and I know you specifically call it health-based dentistry. What does that all mean to you?
Yeah. So I don't love the terms holistic. I don't even like the term biologic. Those are kind of some words. I don't like holistic because when you think of holistic, there's just like this misnomer around it. People think like you're crazy. They think that you're not following science. And then I'm going to be wearing like tie-dye shirts and, chanting or something and incense burning. And, that's just kind of what comes to their mind. And if you come to my office, in fact, it was funny, just this morning at the office, I actually went in because I walked past one of my surgical operatories where my surgeon, I have a full-time periodontist on staff. I walked past one of his operatories this morning and I just glanced and I kind of took a double take and glanced again because we were going into a team meeting. And I thought, oh my gosh, this place is state of the art. And, and I took a video of the room that they had set up. The team is extraordinary. They had everything, even down to a prescription sitting right next to the entrance where the doctor was going to walk in. Then he would sign as he walked in and then hand to the front. I mean, just like everything was just laid out perfectly. So I took a video of it, but I thought, you can never look in this operatory right now and say we weren't anything but top of the line, state of the art, all those kinds of things. So to me, I say holistic and people automatically classify me in a place that I don't want to be classified because I don't fit there. In fact, the very beginning when we started, we put up a big banner that said holistic dentistry. And we had an existing patient walk in and she said, if I'd known that, I wouldn't have come here. We're like, oh, okay. Apparently that's a sign we're going to take down today. So I didn't really like that word. I also don't like biologic because nobody knows what it means. What does biologic mean? I don't know. Even ask biologic people that call themselves biologic and they can't really define it for you. So there's no real definition. That's why I like health-based, because if I tell you health-based, you can kind of figure it out. You can infer a meaning from that. So for me, what does that mean? It means I look at the person and I say, wow, you have more than just teeth. You have a body, you have bones, you have a stomach, you have all sorts of things. You have a liver, you have a gallbladder, you have a kidney, you have all sorts of things. And interestingly enough, what's happening in here actually affects what's going on everywhere else. And not only that, but something super cool. We actually can see signs of what's going on everywhere else in the mouth, which is really cool. So we really, to me, ought to be on the front lines of healthcare. Because we can see things. I can't see inside of your brain. I can't see inside of your gut, but I can see inside of your mouth. And we can tell you a lot about what's going on there. So for me, health-based dentistry is actually acknowledging that the mouth is part of a bigger system and what we do affects all of it. And that's pretty cool.
Yeah, I love that so much. Because also, who are these people seeing more often? They're seeing us. They're seeing us more often. And like you said, we don't have to have a laparoscope go down somebody's throat to be able to see. It's right there. We get to see it all the time. So I love that. So thank you for that kind of definition. And I also think that that's really helpful for doctors who are looking at what do I call it?
Yep.
Because I couldn't agree with you more. You say holistic and people definitely very much get an idea in their head. So I love that.
Yep.
What I'd love to dive into is we have people probably listening who are thinking to themselves, well, I'm a really tiny office, whether it be size or staff or we don't have a ton of patients yet. Tell me about, are there better offices that are suited to this kind of dentistry?
So when I started, I had a team of 5. Team of 5. I was the sole dentist. Some things actually happened about that exact same time that I ended up acquiring another half practice that I didn't intend. And so things grew. But this is how I started, was a very small practice. It's actually a nice way to do it in a small practice or even in a startup because you can just start. You can start doing what you're doing already. People really think that you have to be, what's the word, all in. I believe from a philosophy standpoint, you should believe what you're doing. In fact, there's there's something that kind of drives me a little crazy. In some of the circles that I'm in, they've coined a term called fauxlistic. So faux spelled F-A-U-X, fauxlistic instead of holistic. And basically what this means is they call it bait and switch offices. So an office that says, hey, I'm health-based, the patient comes, and then they have a whole bunch of things that actually aren't anywhere near that kind of philosophy. For me, I say, you know what? My arms are real big. I'm going to let everybody come and let's teach everybody. And if you just want to start with something, great. So do you need to be all in? Do you need to do everything and change everything all at the same time? No. I'm going to tell you, I'll share with you where I think you should start, and any office, big, small, doesn't matter what can do it. And I don't think it matters where you are as well, as far as demographics or even, location. There are people, I don't know if you've noticed, I love this quote. Somebody said, health is the new beauty. It used to be that everybody was talking about beauty, and everybody wanted beauty, but now everybody wants health. And I believe that COVID, really, that whole thing really pushed this right into the center of all of our viewpoints, because now we realize that our healthcare system maybe wasn't as amazing as we thought. Maybe there were some cracks that had exposed, that things were a little shaky for a while there. And we all feel a little unsecure, I think, about our health and about what it means. And we all want it to be more secure. We want to know, how do we take control of this? And how do we ensure that ourselves and our families are going to be well? And so people are really looking right now. They're looking for someone who can give them answers. They're looking for someone that they can turn to if they have questions. And like you'd said, they see us way more than they see their doctor, and they trust us. Dentists are always really high on that trust scale. So I think that it doesn't matter where you live, your office size, your office type, you're going to have somebody in your area that's interested in health, because most everyone is right now.
Absolutely. So that really answers the question for me too. If people look at their demographics, they pull their little open dental report and they see, well, I've got people mostly in their 20s and 30s. I'm probably not the ones, I probably couldn't do this. The answer is absolutely everybody could do this. There's absolutely, and like you said, you don't have to do everything all at once. You don't have to incorporate it all. You can actually help give people, and we're going to walk through this here in just a bit, some ideas of where do you start no matter what the demographic. And, one of the keys I always say is, like, people often are asking for it. If we're just asking, if we're just, having some of the right questions, people are wanting it. I couldn't agree more that, when I talk about occlusion, it's always coming from the health standpoint. I never come from the aesthetic standpoint. I'm coming from airway and breathing, and here's why this is important. And it's amazing. People understand that. They care about that so much more now than ever before. And like you said, I'm just the tip of the iceberg with a few things. So I love that you said this is suited for whether you're a giant office and you're looking to start making changes and you've got 5,000 active patients, or you've got 400 active patients and you're looking to actually find that niche to even grow in. This might be a really cool area to start to include. Ash, anything you can think of as I'm getting ready to kind of keep going through where to get started?
No, I just am finding it really interesting. And I love that, it's like an elephant, right? I love that you're like, you can take like little bits at a time. I think that's really important, and something to not feel so overwhelmed about too. So
yeah,
I love that.
And when you think demographic, age-wise, those kinds of things, who isn't interested in health? I mean, really. And I often tout this a little as inflation-proof, economy-proof, recession-proof, all those kinds of things, because in a down economy, you might have a slowdown in orthodontics. You might have a slowdown in veneers. We might have a slowdown in things that are elective. However, in a down economy, everyone will prioritize dollars towards health. So we haven't had any ups and downs. I mean, we've had just a complete upward trajectory. It doesn't matter what the economy is doing. Our trajectory is always facing upward because everyone prioritizes their health.
Absolutely. Yeah, I'm always scared for the people who are just cosmetic dentists during this kind of, economy. To have something else like this, I think is so important. Well, let's kind of get started with what are the best or easiest ways if you're one of those offices looking to get started? I don't think people even know where to begin.
Yep. Yep. So the starting place I always tell everyone is safe mercury removal. Why? Because you're already doing it. You're already doing it. You're already removing mercury fillings in your office. That's one change I made right at the very beginning is I don't call them amalgam anymore because really it's a little bit of a misnomer. What does amalgam even mean? Nobody knows. It's an amalgamation, but we don't ever use that whole term and nobody really knows what that means. So we call them mercury fillings. They're 50% mercury. And if you look at anything, you will find that every single formulation of amalgam that has ever been has been 50% mercury. Doesn't matter what the other mix of metals is. So we just call them mercury fillings. You're already removing them every single day. I bet you every single dental office that's watching this has removed a mercury filling today. So if that's the case, this is a very simple thing to implement. And here's the other cool thing about COVID. Remember all those super great big vacuums that everybody bought? That's all you need to buy. So it's like perfect. COVID got everybody ready to do this. So there are some protocol. You can get certified. It's called SMART certification, and the organization is called IAOMT. Maybe we can put that in show notes or somewhere, IAOMT.org. They have a certification. Do you have to be certified? No. But do you have to be certified to say you are? Yes, please. But you don't have to be certified. You can go on there, and that's what I did to begin with. I just went on there. I read their protocol, and it's basically you need covers over the body. I can send you all of this. In fact, I can send you a quick start guide, for safe mercury removal. It's very basic. We have a little pack that we put together ahead of time that has a cover for the body, a cover for the face. You use a rubber dam or an isolite, which every dental office already has. You use a nitrous nose, which most every dental office already has. Like these things just aren't that hard. You use the giant vacuum, so keep that COVID vacuum around. And we have a mercury vapor mask for the dentist and the assistant. And I used to use the great big giant one that looks like I'm coming out of a coal mine, one of those kind of things. Try wearing a pair of loops with those. It's pretty entertaining, actually. I'd have to look like over the top of my loops because I couldn't quite see past the little pink things sticking on the front of my face. And finally I was like, you know what? I think I'd rather die than do this. So let's find another way. So no more coal miner masks. We have a mercury filtration mask that fits just snugly over top of a regular mask. So that's the change for the dentist and the team. Very simple, easy to implement. Literally, you could do this for under $500 and under a week. It's just not hard. Then now what you do is you just start telling people that you do it. Oh, when we remove your mercury fillings, guess what we're going to do? We're going to make sure that you don't get any in you. That's it. Like you don't have to be some evangelist and say how horrible amalgam is or anything else. You just say, yeah, we're just going to make sure you don't get any in when we take it out.
Yeah. That's a really easy way to get started. So if they go to that website that you just said, it really will give them exactly what to do.
Yep. And it gives you sources for all of the product as well. It gives you, I think there's like 10 things. You're doing probably 5 of them already, and you just don't even know that you're doing them. And the others are like the gowns and the whatever. And that's all on the site as well. They give you sourcing how to buy it. It adds maybe $5 to $10 per removal. And so this is always a question people ask, do you charge for it? I don't charge for it. However, my practice is fee for service. So I'm not writing off for a PPO. If you're writing off for a PPO, you probably don't have an extra $5 or $10 in that fee to cover that. So if that's the case, absolutely. You charge a mercury removal fee. You can tack it on for $15, nothing very much. That's not going to be something that's covered through an insurance plan. So that'll just be an add-on for that patient, but it's not astronomical. I mean, the fee is really small and the cost to you is really small too.
Absolutely. What a great thing. I was just thinking too, for the team to know that they work someplace that cares this much about it. I'm like, that's pretty impressive too. Like that's a really cool selling point for an office as well, for the safety of their team. Totally. What about, okay, people can go there this week if they want to start to do that. They could actually do that right away. Where do they go next? What's the next spot?
So the next thing that I talk about is ozone. And people are always like, what the heck even is ozone? You know, I'm trying to debate. Actually, there's two next steps. We need to make sure we go down both of them. One is fluoride and one is ozone. So we'll talk about both of these. So ozone is my next step. And this is kind of funny, just because I'm crazy. When COVID first started, there was all sorts of talk about spread in the dental office. And so I did a deep dive into what waterline contamination is. What I learned is actually, you know, this was back in the AIDS era that we were all concerned about waterline contamination. And what I learned is actually the germs, whatever we want to call them, the bugs, they get from the patient back into our water line, and then from the water line are sprayed back out into the next patient. So that's how that spread happens. They go from one patient into the water line through our ports and our high speed, through our air water syringe, you know, they get back into our lines. So the key is make sure that nothing can survive in your line. So we've talked a lot about this, and the industry's talked a lot about this. Well, during the time of COVID, I learned that ozone actually can kill everything in those water lines. So I thought, well, gosh, this is a really cool thing to do. Not only that, you can use ozone gas for the air, you could use ozone water for the surfaces. I was like, hey, this is an all-in-one COVID fix right here. So, and while during the month or 6 weeks that our offices were closed for COVID, I created an ozone course. So I have an online ozone course that people can do. If you're interested in doing it, super cheap, because I was like, let's just have everybody be able to do this. And I walk you through a really inexpensive setup system. So let's just say, what even is ozone? Because everybody has these weird ideas about it as well. Ozone is 3 molecules of oxygen. That's it. So the ozone, or the oxygen that we breathe, is 2 molecules. So when you add a third, it's a third wheel. And that third molecule of oxygen is unstable. He doesn't like being forced with the other guys. He wants to go find his own date. So that third molecule of oxygen goes and it binds to certain things. This is called oxidation. We hear this, right? It's why when you cut an apple, it turns brown. It's oxidizing. The oxygen is reacting with that cut surface. Well, the oxygen in that third molecule of oxygen, ozone, will actually go and bind to bugs. Our cells cannot be bound to, it cannot oxidize our cells, but it can oxidize any bacteria, virus, fungus, parasite, it doesn't matter, which to me, that's super cool. We actually don't even need to know what bug we're killing because it's going to kill them all. So it binds to the outside membrane of that bug and lyses it or splits it open. Then the inside contents of the bug, it's like a hydrogen peroxide, a peroxide material, it spills out and it kills all of its neighbors. So it creates this chain reaction of killing, which is actually really cool. So I thought, well, let's use ozone in our water lines. So we use ozonated water in the lines. That means it's going to kill anything in the line. And, you know, I was doubting a little bit whether it worked or not. I thought, it looks kind of like just regular old water. Let's see if it does anything. And then we moved into a new office next door to ours. It had been a practice for 15 years. So the guy had been practicing for a long time. Second day, literally, I was doing this major 8-hour surgery. Second day, at about halfway through the surgery, the vacuum just seized up. And I was like, oh, crap. And this doctor, he was super meticulous about care with this vacuum. I thought, what is going on here? So of course, I call my husband, come down, you got to fix it real fast. So he comes down and he's like, oh, your trap's all full. I'm like, oh, they must just not have emptied the trap, you know? So he emptied the trap. Start working again, about 30 minutes, seized up again. What is going on? Call him again. He's like, your trap's full again. The trap filled 12 times that day. I didn't even realize what had happened until 3 days later. 3 days later, I was like, it's because I use ozone in my lines. I had released all the biofilm from 15 years of practice that had been trapped in those lines and back into every single patient that he was seeing for 15 years. And 2 days of ozone cleared it out. It was like a colonoscopy, man, for that office, you know, everything was gone. So all of a sudden I was like, I believe, you know, I believe. So we use ozone water in the line so that there's no contamination of anything there. But then everything that we're using is actually cleaning something. So if we use it with perio, it's cleaning periodontal disease. It's taking care of periodontal disease. We use it on the deepest decay in a tooth. So people, a huge tenet of health-based industries, we try to prevent a root canal. And they'll say, how do you do this? We remove decay clear down till you see the pink. You know what I'm talking about. We're almost there. And you know, if you go further, you're in the nerve and you're shot, things are shot. So what we do is we can use ozone right there at that deepest level. It kills all the bacteria in that deepest level of decay, and we can leave it intact. You then fill right over it and you save the tooth. You save the vitality of the tooth, and you watch the surface change. You just use this ozone gas, you do it like this, and you literally watch the surface change color. It changes white, it looks hard, and it's incredible for bonding too. So it kills bugs there. It desensitizes teeth. We use it in every surgical site because it, like I said, it creates that chain reaction of killing. And I would do these surgeries and nobody would be feeling a thing, nothing, no pain, nothing. And then I would use the ozone gas in a surgical site, and all of a sudden they'd go, oh, ow. And I'm like, oh, you know, what's going on? What hurts? Oh, it hurts back in my shoulder. In your shoulder? Yeah, because the infected tooth I just took out had actually spread clear down there, and the ozone had kept killing all the way there, but this was well beyond where I'd numbed. So they couldn't feel it here, but wherever it spread to, they could feel it. Oh yeah, it's in the back of my head. Oh yeah, it's like right over here. And every single time, I'm like, oh my gosh, this is blowing my mind. So it's spreading and killing infection deeper than we were ever able to get with just an instrument. So literally ozone, you can get set up for $1,000 or less. Super easy training. I don't care what course you take, but mine's the cheapest one out there. So, you know, if you want a cheap one, check it out. It's called onlineozone.com. And basically, I just want everybody to get ozone in their office. So we use it for so many things. And that's another one when people are calling and they're looking for a health-based dentist, they ask, do you use ozone? That's just one that they ask for. So you can go, yeah, we use it like all the time. It's super cool. That's the next one I would do.
Okay. And Ashley, you got that for everybody listed. Perfect. I see it. Awesome.
Yep.
So the first one's mercury removal. And what we were saying is that's $500 or less.
Yep.
If you want to add ozone, you could take your course, you could get the things necessary for it, and it would be $1,000 and maybe 12 traps.
Right. So buy a few traps just in case ahead of time. It depends on how long your office has been there.
I was actually thinking to myself, what were you telling that patient the whole time? You're like, one more time.
Thankfully, he was sedated. We just had to keep helping him to the restroom. We're like, it's going to be a little longer than we thought.
I'll be right back again. Okay. Well, give us one more that you would say if people, there's a few people who are listening who are like, I've actually done these things. What would be next?
Okay, so fluoride's the next one. Fluoride's the one that I talk about a lot, and it is the one that is like, you know, dentists are like, no, don't touch my fluoride, don't touch my fluoride. So let's talk a little bit about the genesis of fluoride and why it's really okay if we don't use it. So, because there's like so many patients that come and say, I had to leave my last dentist because they fought with me, literally yelled at me because I wouldn't use fluoride. So let's talk about that. I know I was a dentist. I was a dentist. I am a dentist. I think I still am. Anyway, my kids say I'm not very much. They're like, you're not really a dentist anymore. I'm like, okay, whatever. I still think I talk about teeth. Anyways, so I know all the things everybody was taught about fluoride. I know. In fact, when I first started in practice, I was like the cool kid on the block. I went and I studied all of the fluoride levels in all the water systems in our area. I literally went to every municipality. I created this chart. I sent it to all the pediatricians in my area because I wanted to build clientele. So I was all in on fluoride. Well, as I started getting this health-based practice, I learned that few things that are problematic with fluoride. Fluoride does strengthen teeth. I will never debate that. 100% fluoride incorporates into the mineral. We know what this is called, hydroxyapatite. It changes into fluorapatite. It's stronger and more brittle. The brittle part is the problem. When it's here, it's okay because we have that cushion of dentin underneath. So it's actually all right. But when you get into a bone, it's not. And hydroxyapatite is also the largest component of bone. So it's the largest component of tooth and bone. So it changes the structure of the bone as well. And what they're finding is higher rates of hip fractures in areas that have high fluoridation levels. Well, that's kind of not cool for me. You know, I don't really want to like save a tooth to lose a hip. It just doesn't feel right. So I started looking and thinking, gosh, is there something else that we could use instead? So I started really thinking about, what is a cavity? Well, I tell people this all the time. Cavity is just when the minerals are dissolved in the enamel of the tooth and it leaves a hole behind. That's all it is. So if that's what a cavity is, and then bugs crawl in, well, if that's all a cavity is, well, then why can't we just like put the minerals back that were dissolved out of the tooth? And that to me makes a heck of a lot of sense. Like I always joke and say, well, cavities aren't a deficiency of fluoride. They're not. So if cavities aren't a deficiency of fluoride, then why are we treating it with fluoride? Because it's not a deficiency of fluoride that led to it. It's a deficiency of minerals. So it's all about the minerals. So I started studying, well, can we put hydroxyapatite back into the teeth? Like, can we do this again? And the answer is yes. This is actually like a super hot topic right now. If you haven't noticed, all sorts of people are talking about hydroxyapatite. We don't have to put the brakes on as dentists. We need to just think a little bit here and go back to our science and our dental, what is it called? The dental anatomy training, and so say, gosh, we know what a tooth's made of. Yeah, it's made of hydroxyapatite. All right. So if it's made of hydroxyapatite, then can we put it back in? Yeah. So that's what I started doing is I actually formulated a tooth powder and a mouth rinse that have hydroxyapatite in them intentionally, because I wanted to be able to say to my patients, yes, this is excellent. This is an excellent product. It's going to replace the need for fluoride. And I've done extensive research on this. So if you want to save yourself hours and hours online, just ask me for my stuff and I'll send it to you. I have research articles about hydroxyapatite. I just wrote a big white paper on this, on why we should be using this. And is it as effective? Is it safe? Is it all of those things? So I have all the information about that. The answer is yes, it's all of the above. There's research showing now that it's as effective as fluoride. Is it more? No, but does it need to be? No, it just needs to be as effective because that's what we're using it for, in place of. Maybe it's more, I don't know, but nobody will say that. That's fine. It just needs to be as effective as fluoride. So I also replace it in the office, because that's the other use of fluoride is in the office. So I make, because I'm crazy, I make my own hydroxyapatite varnish that we use for patients in the office. Actually, I don't make it. My hygienists make it. I've sourced the hydroxyapatite from Portugal. They bring it in, we mix it up and make our own varnish out of it. So we can be completely fluoride free in the office because our patients are asking for that. Are your patients asking for that? Not yet. And so maybe you still can do some other, things, but you can then just recommend, yes, if you want to be fluoride free, these are the alternatives and you can feel good about them. I will show you, research will show you they are just as effective. And now we're not breaking bones because we're saving teeth. There's all sorts of other things too. If anybody's studied thyroid hormone at all, you know that thyroid hormone is activated by fluoride. Thyroid hormone is activated by iodine. And iodine, if you remember your science, periodic table, iodine, fluorine, bromine, chlorine, they all live next to each other. That means they're all buddies and they're all like cousins. So if you have a lot of fluoride in your system, what happens is fluoride's a bully. He's a bigger cousin than iodine, and he'll knock the iodine out of the thyroid hormone. So what you have is people who have low thyroid symptoms, but they get tested and it shows that they're just fine. How many people, especially women, do you know that have thyroid problems? I bet you anything that a large majority of these problems are actually because of all the fluoride in our systems. So I'm not okay with that. I was diagnosed with hypothyroidism when I was 22 years old, and I was on meds forever. I've ditched those since because I fixed those issues, but we may be creating hypothyroid problems with all of our fluoride too. I'm actually not cool with that either. So let's just put back what we lost. And then we're helping our patient with more than just one health issue.
So the third one is reducing or giving alternatives to fluoride. If some offices still want to be able to offer it, but if they're looking to get rid of it, where do people find your tooth powder, or where do they find more information about that?
So it's on Living Well with Dr. Michelle. I know it rhymes. That's intentional, so you can remember it very easily. It's a little cheesy.
I love it. I need all the help I can get. So
exactly right.
I'm not sitting here looking at all of this stuff as you're talking. I'm not.
Okay, good. But there's a whole There's a wholesale program on there. So basically I sell it to any dentist at cost, and then you can upsell it in your practice. And I'll just tell you right now. So I partnered with a woman named Carlin Call, who runs Just Ingredients. Your patients very well may know Just Ingredients. She has 1 million followers. Okay. So this woman's enormous, and we partnered together on this tooth powder. The very first release that we had of it, we sold out of 25,000 units in 3 days. Then we got 50,000 units for Black Friday, and we sold out of them in an hour. So basically today we probably have, at least 500,000 people using this tooth powder. And there are people saying, I went to my dentist, I had 4 cavities last time, I have none now. I mean, like over and over and over again. So this is tested by numerous people. And if you have this in your office, you actually look cool, because Just Ingredients is like super cool and trending and hot right now. So you're really cool when you have this product and you're like showing that you're really open to all the stuff that people are talking about, and you're really current. And because I guarantee you, they're all learning about hydroxyapatite. So you need to too.
Well, and I think part of it that I find is patients are coming to us asking these sort of questions. And I think, a lot of times as doctors, we don't know the answers. We don't know some of this information. And so we just keep pressing fluoride as the only option. And I think, what I love about you is you're not saying you don't do this or don't do this. You're saying, here's just the research. And if you can give options, your patients are going to be really happy. And they're both effective.
Yep.
One just has less side effects potentially. So here's just options. And now we can go to our patients, I think, with just better education for them. I have so many patients who I refuse to bully into fluoride, because I'm like, it's your body.
Yeah.
Like, this is your body. This is what, and if you're not going to choose that, I totally get it. So I like to be able to say, but here's options. Here's things you can do that are going to make you feel better for your kids, for yourself, because I get it. I'm a mom too. And I'm like, I love when people have probably just more information. I think this is just arming us with better information for patients. So I appreciate that. So Ash, you put that also on there for everybody. I want to move into, tell me in your office, what does this flow look like? A new patient calls, what do you do with this new patient who's calling and they're looking to become a patient, a record with you guys? How does this look in your office?
So our office is perhaps a little different than some, but patient calls and we schedule them for what we call a comprehensive new patient eval, which is pretty much what everybody's going to schedule as well. I am a huge believer that we should let team do as much as possible, because number one, it strengthens the team. They feel really cool when they have the ability to do a lot that, others will say, oh, really? You know how to do that? That's amazing. So when you come as a new patient to see me, here's what happens. You see a dental assistant first, and the dental assistant takes all the photos. She takes the CT scan. That's non-negotiable in my practice. You're going to get a CT scan, full school CT scan. We just see too much on that to not do that. So we do a CT scan. She takes bite wing x-rays. So those are the first things that she's going to take. Then a hygienist joins her. That hygienist does a full mouth exam, and it's not an exam, it's a screening. I mean, they can tell you things, they can do existing treatment. They can say, is there attrition? Is there abrasion? Is there recession? They can say, how wide does this person open? They can say it's class 1 or class 3 occlusion. I mean, they can say all those things. So that's all they're doing, is they're doing a full intraoral screening, everything except for decay, pretty much. Then they're doing, a periodontal charting as well. Now, in the olden days, I did all of that myself. And so the dentist can absolutely do all that. I'm just like become a prima donna now, and I hate to perio chart. Like my life depends on me never perio charting again, I'm pretty sure. So I'm like, no, we will have a hygienist in there. But if you love to perio chart, you are welcome to do as much of this as you would like as well. Or if you don't have a hygienist to spare, I did it for years as well. I'm actually really good at perio charting. I just don't like it. So they see the hygienist next. And then my care coordinator comes and she does an interview. So they ask, what can we help you with? She goes through health issues. So they've been there about an hour, 15 minutes or so. before I enter the room. I come into the room, they pass off the health history information to me, and then we don't do any chit-chatting. We've learned our lesson there. I just nod while looking at my care coordinator. And then I say, great, let's look through everything. Turn around, lean the patient back, and they read off the entire exam that they've done while I'm just verifying it in the mouth. I do my diagnosis, we sit up, patient goes and sits in the chair. We go through the CT scan, we go through everything that they've said there. I usually will reference back to a health concern. So I will have written on a little sheet what they talk about. So let's say their number one concern is fatigue and thyroid problems. So I will have written that on their sheet. And then I look through their mouth, through their health, whatever, and I will reference back to that. I'll say, I see that you really struggle with fatigue. You know what we just found? We just found some infection underneath this old root canal. Let's look at it together right here. Wow. That kind of thing just wears your body down. You just cannot be your best while you have that kind of infection in your mouth. And they go, wow, that's so true. And you know what? Let's get you off the fluoride. Here's some non-fluoride version tooth powder that's really great. It's going to help prevent cavities. And now all of a sudden, I'm their dentist. We're going to take out that root canal tooth. We're going to place a dental implant. We're going to do all of that. But I'm also their healthcare provider in part, because I've addressed the reason that they're not feeling their best. And I've tied it back to how I can help them. A lot of times we'll also say, look at your airway. It should be like this, and it's like this. You can't breathe, but oftentimes infection is part of the reason. So we are going to start with infection. Then let's see how you breathe. We'll do a sleep study. We'll see, we are committed with you to get you feeling better, to get that thyroid back functioning again. And all of a sudden they would never go anywhere else because you've answered more than what they ever imagined you could help them with.
Well, and I was thinking about those patients who say stuff like, you're just trying to sell me stuff. You guys are always trying to sell me stuff. That just negates, that whole conversation you just had negates any kind of selling anything.
I've never heard that.
Yeah.
Ever.
That's what I mean. You just don't hear that, I think, anymore when you tie things back to truly getting them healthy. And I think that does, no matter how much of this offices try to incorporate, I think just saying exactly what you said was worth the listening to all of this. Like, if we want to be a non-commodity based thing and we want to be trustworthy and respected, I think it comes back to having these exact kind of conversations with our patients that are, I care about your health and here's what I'm seeing. I'm going to make you aware of it. And all of a sudden, I think, like you said, why would they go anyplace else when they know you care about their health and you're not selling anything? Like I said, if anything, you're just selling them feeling their best, and being the best educated possible on their own health, their own decisions. So I love that so much because you guys really truly have just the most amazing office. And it's not because you're selling anything. You're just passionate about health. So
yeah. And I always start off the exam and I always tell them, you know what, my job is to tell you what I would want to know if this were my mouth. Your job is to decide what of it you're going to do. And you may not do any of it. And that's just fine. But my job is to let you know. And they all just go, huh. And then now they're done, and then they may say, oh, this is also expensive. I'm like, you are right. It actually is, but we're going to help you in any way we can. Done. There's a whole financial discussion right there. It's just makes it so easy because we are on the same side.
Absolutely.
I can feel it.
Yep. And that's how I feel all the time too, is like, this should never be adversarial. This should never be, I always tell my doctors, if you're having to vindicate stuff, you've lost the game. Like if you're having to vindicate what you're showing patients, just take a time out because they feel that more than patients, but they also feel that level of conviction and passion and care that you have, Michelle, they feel it from your doctors that this is what we're about. And I'm the same way. I'm always like, my job is just to tell you, what I see here and exactly what I would want to know. What you do with it is absolutely your choice. We're just here to help facilitate it however it needs to be. And I think that's such a huge point. And I do think that's why you're so successful, is you have a whole team of people who feel the same way. And I'm sure patients, they feel it, they can just tell in your offices. So I need to come and hang out there just so I can feel it too.
Right. Anytime. Come on over.
I know. So, one thing I do want to touch base on though is, we've talked through any office can do it. Any office can start incorporating this. We've talked through different areas that they could start in, mercury, ozone, you know, maybe swapping out fluoride for tooth powder, or at least giving options. When people are getting ready to make this journey or kind of switch over like you did, what are things that maybe you would do the same, you would do differently, or have better discussions with the patients? Things that you can help other doctors who want to start doing this, pitfalls maybe to help them avoid.
So one of the biggest things that, and I talk to a lot of dentists that are contemplating this change. There are so many things you can implement. And this doesn't just go for health-based dentistry. This is anything in dentistry. You can go and you can buy billions of dollars of equipment and supplies, and every conference you go to, you could come home with truckloads of stuff that you never use. And that's the same with health-based dentistry. It could just turn into another, buying spree that you never actually use. When I started, I got into a lot of testing, and there's a lot of courses that would consider themselves, health-based courses that really tell you should be testing a whole bunch of things. Like you should be testing their vitamin D levels at everything. You should be testing their adrenals. You should be testing their cortisol levels. You should be testing all of these things. And here's what I found, that when I started testing those things, I started becoming their doctor for those things. I mean, we were even testing HbA1c, which is, a diabetic marker. Well, all of a sudden people were asking me questions about insulin, and my team was spending the large majority of their time answering the phone and answering questions about supplements. And I went, whoa, we have swung way too far the wrong direction. So my caveat now is test what you treat. So if you are going to treat a failed root canal, then you are going to talk about a failed root canal. If you are going to treat periodontal disease, then you're going to talk about periodontal disease. But if you're not going to treat diabetes, you can correlate it back. You can correlate periodontal disease back to diabetes, and absolutely they correlate. But I'm not going to test your blood sugar in my office because I'm not your diabetes doctor. And so that's really, I think, a caveat that we need to remember is we're dentists. And as dentists, we need to focus our time doing dentistry. So do I talk health all day, every day? But it's all in correlation with dentistry. And if you start talking about all these other health things, because there's some cool stuff out there. There's like these cool hand scanners that you can put on, tells you your antioxidant levels. I mean, all this stuff's super cool. But guess what? It doesn't sell dentistry. And if you want to stay in business, you need to do dentistry. So test what you treat.
I could also see how that could potentially throw you into a whole different level of malpractice, of concerns, of like, I would see that could definitely catapult you into a whole different realm of errors that you could be making.
It's out of scope because it's out of our
Yeah.
scope. We aren't educated in that. We shouldn't be doing it. And there's a lot of dentists. I'm glad that people are like, oh, you're such a pioneer. I'm like, actually, I'm not. There's some pioneers up there and they've been shot at by Indians. Like, there's like a lot of people over there. They're like dying on the plains. That's not me. And they all say, oh, you better be careful. Oh, you better watch what you're doing. They tell me this because they have like lived through FDA coming to their office and shutting them down, that kind of thing. I don't go anywhere near that. Like, I'm so far from that level of anything. I'm like, no, we are doing dentistry here, and we are doing state-of-the-art dentistry. We're doing standard of care and plus, that's what we're doing here. And that's what we need to stick with.
Yeah, that's great. That's a really great comment for everybody, because you're right. Like, the minute you dabble in this kind of area, you start down, mercury, ozone, you're going to be tempted by all the new stuff that's getting sent to you. And it is really cool. Yeah. And it can become a whole bunch of stuff that sits in the basement again, like other things. So, a question that you did touch on that I have also heard, anything else with, if you are a PPO office, or you talk to the offices that are more heavy PPO, are there any tips to billing, coding, anything like that you would suggest?
So thankfully, the large majority of what you do is just going to be traditional dentistry, but there are some add-on fees, so those are things that you can look into. Safe mercury removal kit would be one. Supplements are another. And so we do have a mercury detox kit in our office. And so if we're going to be removing a mercury filling, we say, you really need to have a detox. You need to have detox supplements on board that are going to grab the mercury, because no matter how safe we are, you're always going to get exposed to more. They're going to grab the mercury and help you dump it. So we do have supplements that people can purchase in the office. They're obviously an add-on. Ozone can be a non-covered add-on expense. It's $50, you know, if we use ozone during your periodontal treatment or during your, well, we usually do it for no charge during the fillings, but if you're using ozone under that, in that deepest decay, that is indirect pull cap, you know, so it's dentistry. And so there are ways that we're using these products and these adjunctive therapies, both inside of billable expenses, but also outside of billable expenses. Because some of the things they're not going to cover. PRF, we didn't even talk about surgery at all, you know, but we do PRF all the time. We actually have a code, an oral surgery code that we use for PRF. So it is a billable code. There's just ways to make it so that what you're doing is covered if you are, you know, in PPO networks, or if what you're doing isn't a covered expense either, that you then have an additional code that you can charge. So there are ways to do it. Is it easy under PPO umbrella? No, but nothing's easy under a PPO umbrella. So that's, you know, that's what you've chosen. It's you know how to play the game. So it's possible.
Okay. Is there any place, whether it be with you, your company, or anything, is there a way that people can find out more about, you know, really diving into this, figuring out how to bill for it, charging out for it? Is there some place that they should go? Is it that same website that you shared with us?
Yeah, it's called Total Care Academy. Unfortunately, it's super ugly right now. I'm sorry, but I look younger in my picture because it was old. So, you know, it's one reason I like that website.
You look young now.
That's about the only reason. Anyway, we're converting it right now into a whole new mentorship, because this is what I'm hearing over and over and over again, is that honestly, people can find the dental training because it's not really that different, you know, it's just training, but it's how do you incorporate it and turn it into a business? And so we're right now just converting some of these other older things into a business mentorship. Just had a woman reach out to me this weekend, same thing, you know, can you just teach me how to just turn this into a business? I'm like, I'd love to. Let's do this. So coming soon. Basically sign up on that site, give me your email on the Living Well with Dr. Michelle site, and then all the stuff that we have coming out, you'll find out about.
Awesome. Awesome. Well, thank you so much. This has been so helpful. I truly think so many people are going to be going to these websites, finding different resources. And if anything, just maybe thinking differently, just thinking about different options, thinking about really who we can be as dentists. We don't have to just be drill, fill, get out of pain. We truly can be so much, you know, more to our patients and have way bigger impact. So I so appreciate that about you. Ash, anything else that you want to close with?
I just want to thank you for being here. Thank you too for being an incredible faculty member inside of Dental Success Network for us. We're so grateful to have you. And I went ahead and posted all the links that we talked about too. And you know, if any of our listeners or people in this webinar are interested, they can connect with you inside of DSN too, which is awesome. So thank you for being a part of that as well.
Thank you both.
Thank you. Awesome. Well, until next time in October at our next Lady Leaders webinar, we thank you so much, Michelle. Thank you, Ashley, and everybody have a great night.
Awesome. Thanks, ladies. Bye-bye.